Hello, this is the second part of the presentation on cholesterol, why it is so important to know about it. And I strongly recommend that you watch the first part before you see this one for a clear understanding of this topic. So which test? Of course, this is the main question. The name of the test is fasting lipid profile test. And keep in mind that you will need to fast for a 10 to 12 hour period before the test. And the best time therefore would be to do it in the morning. For many adults, this test will need to be done at least once a year. If you are taking medicines for high cholesterol and or high triglycerides, you may have to get this test done more often, maybe once every 6 to 12 months. Your doctor can give you the right advice, of course, on this. What should the levels be? Of course, you get the test done, and if you didn't know what the normal levels are, what good is doing the test, right? These are the best levels. LDL cholesterol less than 100 milligrams per deciliter, HDL cholesterol more than 40 milligrams per deciliter, triglycerides less than 150 milligrams per deciliter, and total cholesterol less than 200 milligrams per deciliter. This is the target that you have to aim for, whether you're modifying your diet, you're taking medicines, or you're doing a combination of both. The most important thing to keep in mind is to try and get to this point and stay there. Like I mentioned before, in some situations medicines might become necessary and your doctor will make that decision. Let's talk about some health tips for lowering cholesterol. It's very important to remember that even if you are on medicines for lowering your cholesterol level, taking the medicine alone is never going to be enough. If you did not change your lifestyle, your eating pattern, there is a good chance that you will keep needing more and more medication to keep your cholesterol under control. And that is going to be a losing battle. The best fats for cooking, we've discussed about the good, bad, and the very bad fats. And of course, the best fats for cooking are the good fats, which are plant oils such as sunflower, safflower, or canola oils. And olive oil can be used when you're making salads and so on. Healthy dairy products. We all consume dairy as part of our daily diet. And of course, it's important that we consume dairy for getting that very important calcium into our bones to make us stronger. So healthy dairy products are skimmed milk or double toned milk. Skimmed milk has 0 fat and double toned milk has 1.5% milk fat. And of course, curd made with the same. Try and avoid paneer, butter, ghee, and other bad fats such as that found in red meat, etc. And these are the saturated fats that we've talked about in the first part of this presentation. And try and avoid deep frying as much as possible. Like I mentioned earlier, when you start using a lot of oil, even if it's the good oil, the calorie content of the food goes up quite a bit, which in turn will lead to the formation of excess fat within the body. Try and decrease your red meat intake. Absolutely essential to remember is to not use vanaspati oil or ghee for cooking ever. And try and avoid fast foods and bakery items which contain quite a bit of trans fats or the very bad fats, because these fats will raise your bad cholesterol level, will lower your good cholesterol level, will lead to the formation of blockages in the form of plaque in the blood vessels, which in turn will increase the risk for heart disease, stroke, and other organ damage. Here are some more health tips for lowering cholesterol. Did you know that high fiber diet will help lower your bad cholesterol and triglyceride levels? It's actually very simple to do this. Make sure that you eat at least 2 to 3 fruits seasonally available every day. Eat lots of vegetables, including the green leafy kind. Make sure that when you cook your vegetables, you use only small amounts of one of the good oils. Eat more good carbohydrates. We all eat either rice or rotis in India as our staple diet. And when you eat rice, switch to brown rice, which has more fiber. And when you eat rotis, make sure that you use flour made with whole wheat, ragi, jawar, or bajra, or a combination of these. Keep in mind that good carbohydrates tend to be brown in color usually, and try and eat less bad carbohydrates such as white rice and maida and sugar. These have low to no fiber content and typically are white in color. And this goes without saying. Stay active, move around more throughout the day. Make walking for 30 to 45 minutes a part of your daily routine. A brief word on medicines and their role in lowering cholesterol. They may become necessary to bring the cholesterol, bad cholesterol or triglyceride levels down, and your physician will need to discuss with you the need for medicines. There are many different brands available. Keep in mind that the expensive brands are not necessarily superior to the cheaper ones. In fact, some cheaper brand name alternatives might be just as effective. Talk to your physician about them. I'll always ask your physician about any important side effects before starting any new treatment. And your physician should be giving you information and guidance regarding the frequency of testing once you start taking medicines. Important to know that periodic monitoring of liver function in the form of blood tests is important while on these medicines. Talk to your physician about it. Most importantly, diet and exercise are not to be neglected even when taking cholesterol or triglyceride lowering medications. It is extremely important that you continue to monitor your diet, your eating habits, eat healthy, and stay active. Please remember the following for sure. There are good fats and then there are bad fats. There are good carbohydrates and bad carbohydrates. There's good cholesterol and bad cholesterol. Eat plenty of fruits and vegetables daily. Limit your meat intake. Avoid frequent snacking. Exercise daily. It will lower your bad cholesterol and increase your good cholesterol. In fact, the only healthy way to increase your good cholesterol is through exercise. Always eat healthy. Eat home cooked food as much as possible. Dabba walas anyone? Thanks for watching.